y'all, this is Loralee Kapp, a Solutions Manager with Managed Outsource Solutions. Today we're going to talk about radiology authorizations, and for a full list of codes associated with this podcast, please see the attached document. Competent revenue cycle management is an essential part of keeping medical practices and hospitals financially healthy. Obtaining prior authorization or approval from health plans to order specific medications, procedures, or studies is one of the most challenging aspects of medical billing. The number of imaging studies requiring prior authorizations has increased significantly in recent years, adding to the administrative burden. As managing radiology authorizations in-house is time-consuming, stressful, and costly, most providers rely on insurance authorization services. As there has been a rise in importance of radiology procedures, the demand for imaging services has spiked tremendously over the last few decades. Medical imaging is used by a range of medical specialists, from oncologists to internists. It has become essential for almost all major medical conditions and is the standard of medical care for diseases such as cancer, cardiovascular disease, trauma, neurological disorders, and many others. Advancements in technology have made imaging faster, more precise imaging, and less invasive. This led to the wider use of imaging for more conditions and for more patients. In addition to its utilization for diagnostic purposes, imaging is also used to treat, manage, and predict illnesses. The increase in the type of volume of imaging procedures has increased the complexity of the radiology workflow. Prior authorization requirements add to the challenge. So, what are some of the changes in prior authorization? Many plans utilize prior authorization to determine the appropriateness of medical imaging studies before the procedure is performed by the imaging provider. The primary goal of prior authorizations in radiology is to control overutilization and inappropriate use of high-cost imaging services. However, MGMA notes that prior authorizations obstruct the delivery of timely patient care, and medical groups are continuing to face unprecedented challenges stemming from the COVID-19 pandemic. Along with a sharp rise of prior authorization demands, practices reported increased denials, delayed approvals for care, and constantly changing rules. If an authorization is denied, the provider has to appeal or wait 45 days to resubmit the request, further affecting the delivery of care. The prior authorization process starts when a specific imaging procedure is recommended for the patient that requires obtaining advanced approval from the patient's health plan to qualify for payment. The imaging center must submit prior authorization request using the appropriate codes. Requirements differ among plans, even those from the same insurance company. Prior authorizations are challenging as insurance companies can deny a claim for radiology services for various reasons, such as not meeting payer guidelines, failure to obtain prior authorization before the exam was performed, incorrect or incomplete information about the exam, outdated insurance information such as the policy has expired, procedure is not medically necessary, procedure is experimental, or incorrect codes and other errors. In addition to the CPT HCPCS codes, prior authorizations requests must include specific ICD-10 codes. Due to the complexity of the process and the frequently changing rules and procedures of insurance companies, it can be difficult for imaging center staff to manage. Outsourcing the task to a medical billing company that provides comprehensive insurance verification and authorization support is the best solution. These companies have insurance authorization and verification specialists who are well versed of which plans require prior authorizations and which radiology procedures within each plan require authorization, and how to obtain that authorization. In addition to obtaining and verifying the patient eligibility prior to the provision of service, they will ensure that the prior authorization request is submitted with the appropriate codes, documentation, and according to the plan's guidelines, which, working with an expert, can help imaging centers increase revenue, improve provider and patient satisfaction, and prevent delays in the patient's care. We here at Managed Outsource Solutions are here and happy to help with any of your back office needs, such as billing, authorization and verification services, so please feel free to reach out to us at any time.